Today let's talk about the radius bone. It is the lateral bone of the forearm and it is homologous to the tibia of the lower limb. The upper end of the radius has a disc-shaped head which is concave, and then it has a neck beneath the head. Close to the neck we can see a radial tuberosity which is present medially. The lower end of the radius is broad, and on the posterior surface it has a dorsal tubercle of Lister. The sharpest border of the radius is the medial border, also known as the interosseous border. Laterally, the radius bone on the lower end has a styloid process. On the posterior surface of the lower end, we can see a few grooves which are for the extensor tendons. Now let's talk about some of the features of the radius bone. The upper end of the radius has a disc-shaped head which is concave and it is covered by the hyaline cartilage. The superior surface of the head articulates with the capitulum of the humerus bone, and they form the elbow joint. The head of the radius also articulates with the ulna and forms the superior radio-ulnar joint. The constricted area beneath the head is the neck of the radius, and it is covered by the annular ligament. The radial tuberosity lies beneath the neck on the medial part. The anterior part of the radial tuberosity is smooth and the posterior part is rough. Moving on to the shaft of the radius, it has 3 borders and 3 surfaces. The anterior border of the radius extends from the radial tuberosity to the lateral styloid process. This is the anterior border. The anterior border is oblique in the upper half and it becomes vertical as it goes down. The lowest part of the border, which becomes sharp and is crest-like, is known as the anterior oblique line. This is the posterior border, which is more prominent from its middle part. The medial border is the sharpest border, also known as the interosseous border because the interosseous membrane attaches to this border. It extends from the radial tuberosity. Moving on to the surfaces of the radius, the anterior surface is present between the anterior border of the radius and the medial or interosseous border. The posterior surface lies in between the medial border and the posterior border. This is the medial border and the posterior border, and here is the posterior surface. Another surface is the lateral surface. It lies in between the anterior border and the posterior border. So this is the posterior border and this is the anterior border, and this is the lateral surface right in between them. Now moving on to the lower end of the radius, it is the widest part of the radius. The anterior surface of the lower end is in the form of a thick ridge, and we are able to palpate the radial artery over here on this surface. The medial surface has a ulnar notch, which allows the articulation of the radius with the ulna. Here they form the inferior radio-ulnar joint. The lateral surface of the radius extends downwards to form a styloid process. The posterior surface has a tubercle known as the dorsal tubercle of Lister, and it has 4 other grooves for the extensor tendons.